You're listening to the Mother to Baby podcast, medications and more during pregnancy and breastfeeding. Ask the experts with your host, genetic counselor and mom of three, Chris Stallman.
Hi, everybody, and welcome to our Mother to Baby podcast. My name is Chris Stallman, and I am a genetic counselor, a mom of three kids, and also a teratogen information specialist. For those of you who don't know Mother to Baby, we are a nonprofit organization that gives information about exposures during pregnancy, breastfeeding, also pre-pregnancy, and for potential adoptive parents. And by exposure, we mean anything that you can encounter during pregnancy or breastfeeding. So things like medications, nail polish, exposures at your job, and in tune with our episode today, things like viruses, specifically the Zika virus. But before we get into today's topic, I wanted to remind everybody that we at the podcast are looking for your ideas. I know that there are lots of people with burning questions out there about pregnancy and breastfeeding. So we want to know what's on your mind. What can we answer for you? So for more information about having your question or maybe even you on the podcast, feel free to email us at contactus@mothertobaby.org. So today we're going to be talking about the Zika virus. And you may be wondering, why are we still talking about this? Isn't this old news? Well, a couple of years ago, Zika was a very hot topic and something that a lot of people were concerned about, especially in certain parts of the world where the mosquito that carries the Zika virus was very prevalent. And there was a lot of concerns about women who were pregnant getting the Zika virus or women who wanted to become pregnant. But it hasn't been in the news as much as it was in the past. So is it something that we should still be concerned about? Are there any updates or new recommendations? So to help us answer those questions, we have two experts from our Mother to Baby organization today. Lorrie Harris-Sagaribay is coordinator of Mother to Baby North Carolina. Lorrie is also lead of our Zika task force, which helps coordinate Mother to Baby's efforts around the current information, guidelines, and precautions related to the Zika virus. And we have Kirstie Perrotta, a teratogen information specialist from MotherToBaby California. Kirstie provides counseling on the phone and also through Mother to Baby's chat feature. So that's when people go to our website, mothertobaby.org, and they have the ability to live chat with a counselor right then and there. Kirstie is also a mom of one, and she enjoys educating pregnant and breastfeeding women every day as part of her job. She has a special interest in the use of antidepressants and anti-anxiety medications, and she is also a member of the Mother to Baby Zika task force. Kirstie, Lorrie, thank you so much for being on the show today.
Thank you for having us.
So today we're going to do things a little bit differently. We're going to talk about Zika virus, of course, but what we're going to do is we're going to talk over some frequently asked questions that we all get through the different ways you can contact Mother to Baby. So that would be chat, like I mentioned before, also phone calls, but we also have a texting program, and people can also email us as well. So we get a lot of different questions in a lot of different ways. And, I mentioned Zika before and sort of, why are we talking about this now? It is the holiday travel season. It's coming up right around the corner. And I know that people love, especially if you live in an area that's really, really cold, the idea of some warm sunshine, tropical escapes, baby moons for couples who are just about to have their first baby and want a little bit of getaway time before delivery. But with traveling comes the question of, should we still be concerned about the Zika virus? So Kirstie and Lorrie, is this something that pregnant women should still be concerned with?
Yes, we should definitely still be concerned about Zika, particularly for women who are pregnant or for couples who are planning a pregnancy. We know that a Zika infection can have a devastating effect on a baby. It's true that Zika is not in the media as much now, and it's no longer around as an epidemic, but there is still ongoing transmission of Zika at low levels in a lot of countries where the epidemic previously was.
And Lorrie, you're right. Zika is not in the news as much as it used to be, but it's definitely still a problem. And we get questions about this every day. Just the other day on our live chat, I got a question from someone who had actually tested positive for Zika, and she was in fact pregnant. And she was wondering, what does this mean? Will my baby be affected? And that's the question I answered for her.
That's a really good question. So what did you say?
So what I told her is that a Zika virus infection during pregnancy can be serious. If a woman is infected right before or during pregnancy, it can cause something called congenital Zika syndrome, or CZS. And the symptoms of that are serious. It can include things like microcephaly, which is a very small head, severe brain defects, joint problems, vision problems, hearing loss, seizures, all sorts of stuff that's very serious and lifelong. And what I told her was that not every baby is going to be affected by Zika when a woman tests positive during pregnancy. And if you look at our fact sheet, which you can find on MotherToBaby.org, we've reviewed a lot of the latest research on this topic, and we quote a risk of about 5 to 14% for congenital Zika syndrome.
And I would imagine that's a lot less than what people would think it is, hearing all the things that they do about congenital Zika syndrome and the symptoms. Do you both find that to be correct, that when you give them this information about how much we expect it to be transmitted, that it's a little bit different than what they originally thought?
I think you're right, Chris, but you have to keep in mind that the 5 to 14% of people that are affected, those are serious, lifelong repercussions. These children require a lot of extra care. So that's really important to point out. We also know that this is a relatively new virus, so we're going to have much more research looking at it in the coming years, and as we learn more, that number may increase.
Another really interesting point about that, Chris, is that the background risk of microcephaly is very, very small. It's a very rare birth defect. And when we look at the pattern of birth defects that congenital Zika syndrome includes, when a woman is infected with Zika virus during pregnancy, her risk of having a baby with this pattern of birth defects is about 30 times greater than it is in the general population. So it's a significant increase in risk. Something else that the research has shown us is that sometimes babies whose moms are infected with Zika virus during pregnancy can appear to be unaffected at birth, but then during the first year of life, they start to develop problems like seizures or developmental delays or difficulty swallowing. Sometimes they can even develop what's called postnatal microcephaly, when basically the brain stops growing. And so anything that we can do to avoid putting a baby at risk for Zika virus, it's good to think of that as we're making travel plans.
And speaking of travel, a lot of questions that we get in Arizona and on the live chat as well is, where is it okay and not okay to travel to because of Zika?
That's a great question, Chris, and it's a very common one that we get. In fact, I got a question on live chat the other day, and someone asked, what does the color purple mean on the CDC map? I'm thinking of taking a baby moon to Mexico. Is that okay? And so this chatter was asking about the CDC map, and if you're not familiar with it, it's a great resource on the CDC's website. It's an interactive map that has color coding that reflects the different levels of risk for Zika in different parts of the world. And so if you look at the map right now, you'll find that it has a lot of purple on it. And what purple means is these are places where there have been past or current cases of locally acquired Zika. And what we mean by locally acquired is that there are mosquitoes in those countries that are infected with Zika and can pass the virus to people by biting them. So in a lot of the places that are purple, we don't see nearly as many cases as we were seeing a few years ago, or even 2 years ago, but there still could be ongoing low-level transmission of Zika virus in these countries. And what purple doesn't tell us is the exact level of risk. We don't have really good data about how many cases are actually happening in different countries, and there are different reasons for that. The ability of any country to report cases in a timely way can vary based on the resources in those countries, the logistics, what their own local priorities are. Maybe they have other health priorities that sort of push Zika to the side. And it's because it's not consistent across the board, it's very difficult to gather reliable data for every country. In addition, there could be asymptomatic cases, meaning cases where people have the infection, but they never show symptoms, they don't realize that they're infected, and so those cases are never reported. So when someone visits an area that is purple on the map, we know that there is likely some level of risk associated with that. We do get questions too about the map with regards to the United States also being in purple. And the United States is in purple because we did have cases in the past in both Florida and Texas. We have not had any cases of locally acquired Zika in the United States since 2017. We also know that because we have a well-funded public health surveillance system here, that if there were any new cases of Zika that were to happen in the United States, we would know about that very quickly, and we would know exactly where those cases were. So just because the United States is currently in purple doesn't mean that we are at risk for Zika virus currently from living here in the United States.
Yeah, I think that was a great explanation, Lorrie. We get that question all the time. People want to know the exact number of cases in a specific country, and unfortunately, it's just really hard to answer that. So typically what I'll tell someone is, if you're traveling to a country that's purple, again, defined as current or past transmission of Zika, we know that we've seen cases there in the past. The mosquito that can carry the virus is known to be present. The climate conditions are ideal. So if you travel there, there's a possibility of infection.
So in terms of the CDC map, that is something that I refer to frequently because I do get a lot of callers who are referred to us through the CDC and they are looking at the map. So we've talked a little bit about purple and the idea of, it's something that was either past or current. But what about the other colors on the map? What about red? What about yellow?
Red is the color that would be used if a country had a current Zika outbreak, meaning that there was active transmission of Zika virus, not just the sporadic cases that we might see in purple areas. Yellow is a country that has the mosquitoes that are able to carry the Zika virus, but there have never been cases of Zika in those countries. There are a lot of places that may have the mosquito, but that doesn't necessarily mean that those mosquitoes are infected. So like Kirstie mentioned, the conditions need to be just right for the virus to actually be passed by those mosquitoes. And then the last color on the map is green, and that is an area with has never had any cases of locally acquired Zika, and it also doesn't even have the mosquitoes that can transmit the Zika virus. So choosing a yellow or a green destination on the Zika map is really ideal if we're thinking about minimizing our risk of Zika.
So we covered a lot of ground today, but I think we're going to stop here. It's not that we don't have more questions, because actually we did get a question about a woman who is 6 weeks pregnant and wants to know if she can go to Brazil next month for her sister's wedding. And for all you menfolk out there, we did not forget you. We're also going to talk about what happens if the father of a pregnancy or the potential father of a pregnancy travels and is at risk for Zika as well. Will that somehow affect the baby or his partner? I want to thank you listeners, as always, for joining us on the Mother to Baby podcast, and special thanks to Lorrie and Kirstie for being part of the show. I do want to remind everybody of all the ways that you can contact Mother to Baby. So, of course, you can find us on our website at mothertobaby.org. You can reach us by phone at 1-866-626-6847. You can reach us by text at 855-999-3525. You can also find us through chat on mothertobaby.org. And of course, our website also has all of our fact sheets and more information there. Don't forget that MotherToBaby is a nonprofit organization and all of our services are always free to you. So we encourage you to contact us with your questions, your concerns, or if you have something specific to the podcast, if you have an idea, if you have a question, if you want to be on the show, please feel free to email us at contactus@mothertobaby.org. Please remember to subscribe on iTunes, Spotify, or however you listen to podcasts. If you go there, you can also catch up on old episodes. If you subscribe, you'll never miss a new episode, and we hope that you will join us next time. So signing off, this is Chris Stallman. Remember, MotherToBaby is here for you. Take care.
MotherToBaby is a service of the nonprofit organization of Teratology Information Specialists and supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. It's made possible through generous donations from listeners like you. To learn more about MotherToBaby, please visit mothertobaby.org.